For a hip replacement, typically we see patients when they're about 4 to 6 weeks out of surgery. So I would say after they hit that 4 to 6 week mark and they start coming here, we usually see them for another 8 weeks. So I would say total time, usually around 12 weeks or 3 months. Kind of depends on where the patient is in their recovery. So immediately post-operatively, within the first couple of days, the patient gets up and starts walking. They will do glute sets, which is just kind of squeezing the buttocks. They'll do quad sets, which is just squeezing the knees. They'll do ankle pumps to promote circulation for the entire body and lower extremities. And then as they're able to, they'll start to do some more active range of motion. Typically, immediately after a hip replacement, the patient isn't allowed to do certain movements, and so the exercises have to be within those restrictions or parameters. And then after they are further away from their surgical date, the patient is generally allowed to start to go past those restrictions. Those restrictions are lifted, and so the exercises get more and more challenging. So we go from doing those glute sets, quad sets, and ankle pumps to standing hip abduction, flexion, extension, and then maybe some stuff with weights or with resistance bands, sidestepping. And then as they get better and better, we can do things like squatting and more activities that are, or exercises that are related more towards getting back to different activities that they want to get back to. So immediately post-operatively, the role of the physical therapist is to explain to the patient what those precautions are and what restrictions they might have with their new hip. And then again, after the patient is released to home, then the physical therapist provides home exercise programs, exercises to be performed in the clinic, and sort of with regard to where they seem to be most weak, where they have limitations in range of motion, and how we can better get them back to their activities of daily living. That's a really good question. So a lot of patients do much better after they exercise before before having their surgery, but oftentimes people are in such a severe amount of pain that that excessive movement can be difficult or painful. So optimally, I say yes, try to at least do, the bare minimum, whether it is those glute sets, quad sets, and just doing active range of motion. No real heavy weights, because that usually ends up causing a lot of pain to the area. But yes, trying to be as strong as possible before going into surgery is the best way to set yourself up for the most positive outcome. Typically, yes. Typically the patient is given a walker to start out with, and then very quickly they can be progressed to crutches, and then maybe a cane or a single crutch, and then nothing at all. Sometimes people say that sitting for long periods of time is uncomfortable because it just doesn't feel like their own hip, and it's not. So it takes a little bit of time to get used to, but usually within like 6 to 12 months the patient feels like the hip is now theirs and it doesn't feel so awkward. So yeah, they might notice a few things, that it just doesn't move like their old hip, but a lot of times the patient was in so much pain and had so much lack of mobility that having the new hip feels great to them. And they don't have any more pain anymore, so that's all gone, so it feels a lot better to them. But you get the occasional situation where people feel uncomfortable just because it's a prosthetic object.